share with you that the bulk of the apps, the 2 apps that we're looking at today, this first set is really dreamed up by Sarah. So Sarah and I have been in close communication, and I really think she's an innovator. She has created a fantastic collection of neuro intervention techniques. We're busy building very significant neuro rehab simulations that we'll be releasing probably in the next, I mean, 2 of them are done. They just take a lot of vetting because we don't want to release simulations that create chaos. I'll share some of what we're doing on the neuro side with you in a second. So Sarah's at MUSC, and I think she has a great vision for neuro rehab. She is in charge of their neuro residency as well. The PNF app author, you'll see Amy Radu was one of my alumni. She is now an instructor at the PNF program at Kaiser Vallejo. And I recognize very clearly from many conversations I've had with a number of you, how PNF is not really recommended as something that should be taught in entry level. I think this is a challenge that we are trying to navigate. The resource is available. I'll show you the resource. Some programs are teaching it, some programs are not. And I'd be very interested to hear your perspective about that. Is this something that that most of you are not teaching, or that you have continued to teach in some form? At the very least, this resource is available for you. And I think it's a really quite a powerful resource. I did talk with Amy actually a couple of days ago, and she said they're working on research. They have a big list of research, and they are working on research over at Kaiser Vallejo. So, and then once we get to the PNF app, I think we can talk a little bit about that. And then Dr. Mary Hudson McKinney, a dear friend, and also one of my co-instructors in the past, she worked very closely with us as we just, as you might have seen, released the task analysis app. So the task analysis app is based around the 2 common models, Hedman and Sheets. And you'll see that we have filmed a number of different patients, following them in multiple functional activities that they do in their daily life from multiple views as a resource for you to utilize in your classroom. I think it's an amazing resource. Towards the end, I'll be happy to show you a glimpse of what it looks like. So when we built this app, the PNF app and the neuromuscular rehab app, it was a follow-up to our neuro exam app, which I talked about in our last webinar. And that was essentially the collection of all the neuro examination techniques that your students will have to learn in entry level and beyond, really. So that is a comprehensive app that covers balance, Asia, Fuglemeyer, stream, vestibular, everything that you need to teach students is filmed and organized and easily deployable in your classroom. So then we said, hey, we should think about how are we going to help faculty teach about interventions, give them a library of videos that can be utilized. So really the question we were trying to answer was, how do I introduce neuro rehab interventions, these procedures in an efficient and long-lasting manner? And what I mean by long-lasting is, I think the old model of when we demonstrate something once and hope that the students can remember it, that day should be long gone. We know that that increases student anxiety. It's not a great way of learning. I really believe, and really this comes out of my ortho background, we have 50 to 100 techniques they learn every week. And then you add on the therapeutic exercises, another 50. That's 150 techniques per week. Can they just be exposed to it in 2 5-hour labs and hope to retain it, to learn the motor skill, to develop the clinical reasoning, to apply it? I just don't think that works. And so we have been trying very hard to encourage students to watch videos for that lab week before they come to class. They are pre-exposed to the techniques before they come to class. When they come to class, they see the techniques again. When they leave class, they look at those techniques and practice through their videos again. That's what I mean by long lasting. I think motor skill development should be a graded exposure process. So that other question here, how can I expose students to a set of motor skills traditionally used in neurorehabilitation? You'll see a lot of those skills available in these two apps. So let me just take you there for a second. I'm going to go to here. If you log into PhysioU and you sign into your account, you'll notice that there are some new things that we've started to release. One, we've got a bunch of e-learning simulations. Two, you can find the apps based on your content area, because there's so many now. If you scrolled through here, it'd take you forever. So we've tried to organize it. Here's Neurologic Rehab. And you can see now, here are the apps that we've sorted for you. And I also want you to see that here under Educator Resources, we've put an automatic link that will take you to the Faculty Resources page, where you can find out about webinars, upcoming webinars. And you can also check to see if there are lab handouts. So here's teaching content, lab handouts. We have lab handouts already created for you, Neuro exam, PNF, right? So these two related to neuro, we already have created. And what I mean by created is, for example, if you look at all of the PNF patterns, we have a Word doc that you can modify to your own need, or a PDF that has all of the techniques with the hyperlink to the video. So it takes you directly to the video in PhysioU, and the instructions as matching in the PhysioU app. And of course, these instructions also match the lab handouts from the Kaiser Vallejo PNF program. So you have this type of resource to assist you in this crazy time. You don't have to build it all on your own. Let me go back to the app itself. Let me go back right in here, and let's take a look at Neuro Rehab. So here, under the neuromuscular video library, you'll see that there's a collection of different things that you can do. One of the things Sarah mentioned to me that she likes to do at the beginning of her neuro rehab class is she has her students on the first week go through each part of this neuro evaluation. So for example, here is Sarah doing the patient interview, and there's also a quiz here that the students will take as they are watching this patient interview. I think what's ingenious about this is that it's not just a passive viewing of an evaluation process in the neurologic setting. It gives these little questions that when you click on the wrong answer, it tells you why it's wrong. When you click on the right answer, it tells you why it's right. And they are using this as they're watching this evaluation go through. If you move back to the evaluation, you can see this is gait observation. They're observing gait here. So many of these will not have sound because the sound was extraneous. She took the sound out. And then here's the quiz questions below that. So here is video and the quiz. Do you think ambulating without a brace is a realistic goal at this time? Right, remember, this is the beginning of her neuro rehab class. So the questions are skewed to kind of beginning to shape the student's mind about issues that the clinician is thinking about during this evaluation. So correct, her gait deviations are much more pronounced without her brace. At this time, she needs brace for safety. So the learning is going to occur asynchronously as they watch this full neuro exam. So our neuro class in our program starts after ortho. They have a very defined way of thinking about evaluations. And I think it's really powerful for the student to be able to go through a full range of motion, tone, spasticity, look at a bunch of outcome measures, look at the questions that the clinician is thinking about. They get to watch all of this on the real patient and really get an introduction of what a neuro eval is like. Let me just stop for a second and ask, do you have any questions about this component of this app and how to use it? Feel free to unmute yourself or chat something in. James is always manning the chat. Okay.
Mike,
well, yes.
I ask, and you folks who are knee deep in the neuro training unit, how helpful would it be that your students would see this at the beginning of the neuro unit, and that way they have a context? It's like trying to describe the ocean if you've never seen it. Well, let's have a video of the ocean, and then you can describe it. So, I wonder if if you guys think it'd be helpful.
Any thoughts from the group?
All right, Malika, I'm going to see how much range of motion and kind of impede with function.
Sorry about that. Any comments from the group?
Yeah, hi, Mike. This is Teresa Beeson. Sorry, I just came in from another meeting.
No worries.
I have used several of these videos with my students as prep, where they see it kind of at the beginning before we do the hands-on practice in class. And I think it's really helpful. And it also gives them something to refer back to if they get stuck.
Yeah.
So I actually will often use it preemptively as an introduction.
Perfect. Thank you. Yeah, I've been thinking about this a lot because the chaos of an orthopedic course that spans 2 semesters really, in my mind, 20 years later, after being an entry level for 20 years, I really believe that a lot of preemptive scaffolding really changes the way students can receive and store and retrieve information. So when you create a picture in their mind, oh, this is what a neuro exam looks like, a neuro eval looks like. And then over the next few weeks, you are teaching them components of that. You can always refer back to a picture that they have in their mind of what was happening during that eval. Things get more clear because there was this seed, there was this frame for them to hang this individualized content that you're delivering week by week. So yeah, I totally agree, Teresa. I'm glad, the other thing that you'll see when I show you just a glimpse of the Sims is that we have interspersed little interactive things so that when a student is done studying about balance, they can play a game related to a real patient and do some interpretation and application of their knowledge. I think this is another key component of helping students really unpack what they're being taught, apply it, and really take them that next step to really make it clinically relevant, clinically useful. Perfect. So let me move on to here in the neuromuscular video library. You can see that there's interventions as well. So Sarah and I have talked through, we will be reorganizing all of this into even more finite and easy to find categories. It's on our list of things to do for 2022. But you can see that a lot of the basic techniques that you're going to be teaching are all here available for students to pre-watch or available for you. We're going to be on Zoom indefinitely, at least for the next couple of weeks. And then who knows what's going to happen for the rest of the semester. We're going to be using these videos a lot because when I can demonstrate a video and then occasionally silence the video so that I can talk over the video.
The third facilitated bridging method is used for a patient who is more dependent or requires more assistance. The therapist should first begin by placing a draw sheet under the patient's hips and pelvis. The therapist then asks the patient to bend both knees into the hook lying position with both feet on the support surface. The therapist is seated on.
So sorry that my streaming, because I'm also streaming my video. You can see that a lot of these techniques are going to be the same ones that you will be teaching the students in class. Imagine if they can be watching these techniques once on their own already, so that when you get to class, if you're separated in pods, we just show it on the screen. We just pull it up on the screen via Zoom. Or if you're demonstrating it to the group, then they can go back, have the videos on their iPads and on their phones or any device they're using, and then practice. So the efficiency of lab is another thing that many faculty have talked to us about. When students have pre-watched a lot of these videos, they can get to practicing much quicker. So you have these different interventions. You've got, transfers, hypotonia and weakness. Let's just take a quick look at some of the different selections that you have here. Oh, there's a little typo that we can get fixed here. So I think what I want you to see from this component here is that there is quite a broad collection of intervention type videos that you can utilize in your classroom to support the student learning. You don't have to film it all. We filmed all of it for you. Okay, so that's the intervention video library. The other thing that she's done is she has a number of different patients. She's categorized them by the condition here. She uses a lot of these videos in her class to create context. What I've asked her to do, which we've begun to do, is we've created these little worksheets here. Case study 1, case study 2. Here's the student questions. So let me grab that. You can take a look at it. Make that a little bit bigger. So here's case study 1, the basic background on the patient. And then there's some discussion questions. This allows you as a faculty member to now leverage this case study 1. Let's see, case study 1. And be able to ask relevant questions with the class. So she has a number of these. She's working on more of those worksheets for you, but you can see that there's Parkinson's patients, TBI patients, patient interview, kneeling intervention, gait observation. So she has a lot of these videos now that you can at least play and use to teach whatever you feel like you want to teach. At least there's this library here that's available for you to utilize. Teresa, I don't know, have you been able to use any of these and how have you used them?
I have used some of them as like an introduction to certain courses. So maybe we say, hey, this is the patient that we want you to keep in mind for today. Or if we want students to mimic a patient presentation, we might use them that way. Honestly, as you're talking through some of the updates that have happened, I'm getting more and more ideas of how to use them. Yeah. But oftentimes to either emphasize a topic that we're talking about or to give the students sort of we want you to sort of think about this scenario when you're focusing on this particular lab skill or treatment planning or whatever. I also use them a lot for movement analysis. Just straight up kind of mute them and let them go. Yeah. For movement analysis. So yeah.
That's perfect. I mean, that's in some ways, before I go on to the next part of the app, let me just actually show you, let me take you, when we talk about movement analysis, if you look at task analysis here, you'll see that in the learning phase of task analysis, we have these 2 different versions that you can utilize. And what Mary has done is she's taken a couple of the test items, test movements. You can observe the test movement.
Right, so the next one is you're going to sit here. Arms can be resting on the lap. You want to sit tall, shoulders back, head up.
So she does something like that, or sit to stand. This is the sit to stand version. You have different views of that movement. You have both views at the same time. And you get to see how Mary has documented what she saw, just as an example, because this is the learning phase. So in the learning phase, you also have Headman, and you have all of these different videos of patients doing different things. Here she is doing toileting. And you can see that Mary has also done the documentation for that. So in the learn phase, this can be utilized as a way to introduce students to these different forms of movement analysis or task analysis. Then when you go to practice, you'll see that, for example, in the Headman, you have typical female, typical male, COPD patient, right total hip patient, CVA right-sided hemiparesis. So when you look at any of these, you'll see that we have created a collection of the videos doing all kinds of common things that they would do, getting in bed, getting out of bed, getting on the toilet, getting off the toilet, grooming. All of these videos are now available for you to do movement analysis, task analysis. So that's just, Teresa, if you haven't seen that yet, and for all of the neuro instructors, it's the ultimate library of functional movement that you can now leverage to help students see, and it really contextualizes the patient's movement dysfunction, so to speak, or movement challenges.
And Mike, I think about how, oftentimes we try to do these in-person labs where we bring in individuals who've experienced some sort of a neurological condition, stroke or what have you. And either we can't bring them in depending on the COVID restrictions, or if we have students who miss the labs, I feel like this type of a thing would be an awesome way to have them make up the lab so that they still get the learning experience from it.
That's right.
Instead of, trying to fake it. So I love this resource for that, because I'm currently working on lab assignments and alternative lab assignments, because I'm certain that we're going to have students that are going to miss some labs and need to make them up so that they can still get credit and still have the learning. And I think this is a phenomenal way to do that. So
yeah, that's perfect.
Mike, Amy has a comment in the chat, and
Sure.
if you want to sneak a peek at real quick,
Yeah.
about diagnosis.
Oh, I missed where you got your diagnosis specific case studies. Oh, okay. Yes, I'll show that. I'll go back right to that app. I was just going to say that for the bulk of these, we have a video of the typical, so that you can just switch from atypical to typical and have a comparison of so-called normal movement. You know what I mean? So that is the task analysis app. I would invite you to check it out. It's really cool. It's really cool. If I go back to those case specific, so this is in the Neuro Rehab app. If you go back to the neuromuscular video library and you go to case studies, you will see here under Parkinson's an interview with a Parkinson's patient, 10-meter walk. We can just take a look at that. 5 times sit to stand, timed up and go with a Parkinson's patient. Here's case 2. So that's where all of these for Amy, this is where all of those videos are available under case studies. Okay, I hope that's useful. And then what I would say too is so you've seen evaluations, interventions, and case studies. I want to take you back to the resources that she's put together. So she has tried to basically collect what's available so that faculty can easily deploy all of these different balance measure tests. Here are these little PDFs that you can just download to make it easy for you and the students to get access to. Okay, so she has this little collection of outcome measures and different Word documents. Here's wheelchair, disease-specific measures. We can take a look at TBI measures.
Mike, quick question on that.
Sure.
I also saw that there were some documents related to not just outcome measures, but like practice guidelines and things like that. Maybe not, maybe it wasn't in this section. Am I in the wrong section?
It's right here under articles and evidence-based practice.
Sorry, didn't mean to skip.
No, that's perfect. I was going to go there. So she's also tried to create she has this, she loves this part, this important websites part, where she's kind of linked all the basic key websites that students should be aware of. So a lot of that is, let me go back to, where was I here? Yeah. So a lot of these resources here, oh, she's going to have to go, we're going to have to go back and double check some of these links, but a lot of these different documents that are available are all linked in that particular site. James, if you could make a note that we should talk with Sarah and go back and update some of the links. So yeah, that's where this is. All of this stuff. So that's the Neuro Rehab app. And you get to it essentially, if I go back to all of our apps, if I switch to Neuro, you'll see that you get to it through this neuromuscular rehab app, and you get to all of this. So that's the Neuro Rehab side. Let me take you to a quick glimpse of the PNF side now that you've already looked at task analysis a little bit. So with PNF, Amy comes down to teach it for us. We are in discussion about whether this is to be taught or not. I'm curious about whether you guys are still teaching it in some form or exposing the students to it. In my conversation with Mary, she said, hey, Mike, we don't have evidence for everything. There are elements in what they do that I find to be very useful in clinical practice, so I show it to them. And so that was Mary's point related to PNF in our program. So what you can see is we have created videos that cover the basic philosophy. These are all things, if you're still teaching this, that students can watch asynchronously. This is just, I guess I can show you here. So let's say you have the PNF philosophy content. You can go here. You can see this new sidebar that we've added, okay? This is the educator only resource, which means that you can copy page title with link, let's open a new document here. And you can essentially copy and paste that entire section. It's already hyperlinked. You can just paste that right into your syllabus or your LMS. The students are just told, this is what you want to watch before you come to lab. So they will go ahead and watch all of this. Let me go back to where I'm at here. They will be able to watch all of these different videos. Okay, so that's the PNF philosophy side. You can also see that there is basic principles of PNF, manual contacts, traction and approximation, quick stretch, irradiation principle. Let me just give you an example of that. You can watch the instructional version, which is her giving her whole spiel, or you can just watch the highlight version, which is just the actual movement of the task.
The therapist using the upper extremities to allow for radiation into the trunk, facilitating trunk activation.
Okay, so those are your basic principles. And if you move into the different techniques, there's always an introduction. Then there's these different rhythmic initiation, replication, combination of isotonics, all of these techniques. Then we can take a look. So here is an introduction. This is the instructor sharing about what this is. So there's a short slide that kind of describes what this is for. And then you get to watch the technique itself.
Rhythmic initiation is going to go through the passive, active assisted, active, and then the independent motion. It could be used for any functional motion. So we're going to use for reaching for the cup. The key to make this successful is your verbal cues have to set the tone and set the pace for the motion. Okay, I'm going to start here. I want you to open your hand and reach for the cup. Good. Do that again. You're going to open your hand and reach. All right, help me out a little bit. Open the hand and reach. Nice. Help me a little more. Good. Now help me a little more. Nice. Now help me more. Go.
So what you see there is the techniques are all available for you to, again, link to your lab handout. So remember, you can take any one of these techniques, copy the page title with link, drop it into your document, That might be your lab handout. And if you want, you can also copy the picture. So copy thumbnail image. Again, I can just command paste. And now you have the image. You have video links and images of the techniques for any of these PNF techniques. You can't quite do that just yet with the Neuro Rehab app. We are working on bringing it in-house. Right now, it's on a different server, and soon you'll be able to do that. We're hoping to get that done in this next quarter of the year. So that is the PNF technique side. If you look at things like PNF patterns, I just want to give you an example of this. So let's just take one of these videos, for example. Look at the highlight.
Your goal is to get the patient to end in that position. The wind up starts from mid-range. You wind up all components into extension, adduction, internal rotation. My manual contacts are further distal on the extensor surface of the wrist with my 4 fingers off to the side and then my thumb on the ulnar surface. My proximal hand kind of comes around just on the lateral side of the arm. For the pattern, when you wind everything up, you want to make sure the wrist crosses midline and is approaching the opposite hip, and then the elbow is approaching midline. Verbal cue is wrist up, stay back, hold. The end position, the landmarks, you want the arm just a fist width away from the ear and the thumb to be pointed down. Things to watch out for. When you start, make sure you're not going to tip the scapula by bringing them overly extended or adducted. This disconnects the scapula from the trunk. Also, when you end, make sure you respect the scapular plane of motion and don't go past it. Or a lot of times patients prefer to go too wide. So make sure that it's only around a fist width away from the head.
So you have this collection of videos. We've also made an attempt to try to connect the movement to function. The patient position, therapist position, manual contacts, elongation and commands, appropriate resistance and body mechanics, and important considerations. And we've also tried to put in some orthopedic neuromuscular significance, because certainly we can apply this in multiple settings. So a lot of thought has gone into how are we going to bring this technique, make it simple for students to learn, and give them a stepping stone towards why they would use it and how they can apply it in multiple settings. So you have all of your upper extremity, lower extremity, and trunk patterns. You have your rolling. Here, let me just give you an overview of your rolling introduction. Right, here are all your different techniques to assist with rolling. You have progressions, prone, supine progressions. So here you have your prone, pivot prone, prone on elbows, quadruped, tall kneeling, half kneeling to stand. You have treatment in sitting. And you also have PNF gait. And I think one of the cool, unique things that we did this year was, or actually we did when we filmed this. So there's a bunch of functional applications here, upper extremity, functional application of this particular pattern. Take a note of that. We can fix that in a second. And she has done an evaluation on a patient. So here again, a great opportunity to watch the subjective exam, then to look at the pre-treatment assessment, which will include the movement analysis. Here are the key movements that were observed, the outcome measures that she tested. Here is the treatment that she decided to do. Some post-test, the effect of her treatment on the patient's movement. Here's treatment in standing. And then here is post-treatment, reassessing the different movements after treatment. Here are the outcome measures after treatment. Home exercise program that she basically said, this is why. So we said, hey, discuss why these exercises were chosen for the patient. So it's something that students can watch together with you. And then post-treatment subjective. So she's now kind of landing the plane, so to speak. This is after the treatment. Let's talk. And here's a treatment recap. Here's what I found. Here's what we did. She explains the entire thing that the students have just watched. So again, just like every student that I've ever had who says, Dr. Wong, I really wish I could watch you doing evaluations and treatments so I can better understand how to apply all of this stuff you're teaching me. You can see now that this particular app has a full evaluation, treatment, and reassessment related to the application of PNF principles. So that covers the Neuro Rehab app, as well as the PNF app. And it's also given you a quick glimpse of the task analysis app. I know we're short on time, but I'd like to just open it up for discussion, for comments, for questions. Any thoughts? Any thoughts or comments? And you can feel free to just unmute yourself and chat in. This is just an open time for us to chat.
I have a question. I know I've been teaching PNF now for over 20 years, and at some point they changed terminology from like slow reversals to dynamic reversals. And then I've also seen it like with both terms, and I was just wondering which one you use, and is there a preference?
Yeah, I would say that. So we filmed this app probably 2 or 3 years ago, and this is the latest update of what they're teaching at Kaiser Vallejo. So I would assume that that would be the terminology that, because I've told her that the reason why I wanted to build this app was because I wanted to try to standardize, right? And so she knows that and is probably using the most, the most recent language change. So I hope that helps, Laura.
Yeah, it gets confusing.
Yeah, it gets confusing for sure.
Thanks.
Yeah. Other comments?
Yeah, hi, this is Nick. Just super impressed with the resource and thankful for you guys putting it out there.
Absolutely. Absolutely. Thank you.
I think it's hugely helpful for students that have never seen these types of patients before to have this as a video resource. And it's so much nicer than trying to YouTube all these crazy things. So I think it's been a really, really big help in education to have this.
Fantastic. Yeah, thank you, Denise. And also thank you. Yeah, I would say that when you think about the simulations that we are building, if I just take a moment to give you a glimpse of that, you can see that here, we spent every penny we made last year, we have spent it all building all of these interactive learning. A lot of them, particularly in neuro, are built around real patient. For example, timed up and go, modified Ashworth, Romberg. So we pick and chose a number of common functional tests that students are going to have to do. And we made it such that you could just say, hey, so we learned balance this week. I'd like you to go in and play this little game out. And so one of the things that I was going to show you, something we recently released, I was just chatting with Teresa this week on email, is that for faculty, you have a course key. Okay, students don't have access to this. The course key basically allows you to see every single slide in the game in the span of 30 seconds. So you're going to see that here's the question, 65-year-old male with spinal cord injury. You want to assess his fall risk. What is the right test you should do? And you get to see the answer. So here, as you click through, you'll see, how do I set up the timed up and go? How should the patient, when does the timing begin? When should, let's see, how do you accurately conduct the timed up and go? So you can, in a glimpse, know what your students are going to experience. I think that's one of the biggest problems with simulations today, is you have no idea what you're asking your students to do. I don't think that's good for education. So as a faculty member, you can go into any of our simulations now and click through the entire simulation with all the answers and just get a sense like, great, that's going to be useful for me. I know there's no like landmines buried in there that I'm going to have to explain later, right? Those are all the barriers that I would face trying to use simulations. So in this part of the video, the patient is going to actually perform the timed up and go test. You hit the timer when the patient's back leaves the back of the chair, and the timer starts, and you stop the timer when it's time to stop the timer, because we're going to ask the student, what time did they get? And then we're going to ask the student to make the recommendation. Should they use assisted devices based on the time that you chose? And so the hint button will give them kind of the breakdown of the time cutoffs for the different recommendations. So that's one way to look at these different simulations in enhancing learning for your students. Think about I guess you're seeing my teaching philosophy, and I think a lot of our teaching philosophies eventually being played out in what we're creating. One, students need a stable and easily accessible resource to learn motor skills. So I think that's really important. Two, they really need patient context to figure out how all of this comes together. Three, I really think it's valuable to create ways for students to interact with their own knowledge in low risk, low stakes environments. I think that is where learning can occur, because mistakes are normal for learning. Let's give them places to play. And then eventually what you can do, so let me go back here, what you'll see in all of our games, so is the ability for you to hold them accountable for doing them. So what I mean by that is, if you take any of these games that I've done, for example, there is a learning history. Your students can submit to you a learning report that will show you their highest score. I always tell them, play it as much as you like. I will give you a point for that highest score, 100% of 1 point, let's say. And you will be able to see how many times they've taken it, how long it took, and what score they got, if you want to see that. So this allows you to turn this into a interactive, asynchronous learning experience that you can just reward with small amounts of points. It's not linked to your LMS. It's quite a nightmare to try to link to all LMSs. So we've created a very simple way for them to be able to download and show you that they've done what they've done. So that is a glimpse of the Neuro Rehab app. Other comments or questions?
Mike, I do have one quick question about the learning reports.
Yeah.
I see that you can do that for that specific learning activity. Is there a master learning report that would combine all of them into like one document if I wanted them to send me stuff at the end of the semester? Or
not quite yet.
Okay.
Not quite yet. It's if you can imagine, one, it would require your ability to create a group. Right. And so it's on my list. The tech team knows that this is the kind of thing that faculty kind of wish that they could do. It could be quite messy. You don't know how many students are actually sharing subscriptions.
Oh, right.
Right. So
sure.
I like the idea that faculty can easily take, let's say, a CSV file of all their student emails and create a group. And perhaps in the new LMS that we're building, which I don't know if any faculty really wants a new LMS, but there is functionality that we could do something like that. But for now, the only way they can do it is just turn in their learning report. And then I just double check that they've turned it in and I give them points for doing it.
Do you mind showing where they get the learning report?
Yeah.
I've not used it in that way before, and I would love to know
Yeah.
how
So
they would do that.
if they go to any of their sims, so if you go back to any of the range of motion sims,
Sure.
every single sim is tied to their account. So their learning report, their learning history is here at the bottom of any game that they play.
Okay. So
And-
it does give them, a readout that they could screenshot or
Well-
snipping tool to
well,
us.
They can just click this download learning report and you will get a form that looks like this, that it's already something they could just dump in a Google Drive box for you.
Perfect. Thank you so much.
Yeah. So just so you can see all of the different sims now, all of the different sims modalities, range of motion, orthopedics, all of them have, for faculty members, interferential, there's a key. So all of them, you can now see what you're about to deploy into your classroom very quickly. And I haven't played this one, so I don't have a learning history down here, but all of your students, this has surprisingly been very popular among the student users. They're like, thank you, I want to play with my knowledge. So they're just in there playing around and learning. So I think that's also kind of cool, right? Is if you can turn learning into games, maybe this generation will actually play it. They'll actually play on their own. And I think that is really special. Other comments or questions that I can help to answer? Any other comments or questions?
Like I'm hogging. Is there a list of all the mini sims for PhysioU? I know you had, some lists of content, but is there a way to access that?
Yeah, we are about to update this page here. So if you go to the main homepage under educator,
Yep.
here under physical therapy faculty, you'll see that there's a simulations and e-learning page.
Okay.
For example, we just added a bunch of new sims, so new simulations added to the web app. But I think based on your comment, I will have the team build for each of these. You'll be able to click on each of these and see the list of sims that are available for each category.
That would be amazing, because I think it would be easier to plug it in as we teach it. This is what I want to see, by this date of these mini sims done. And it'd just be easier to see it kind of in a big picture instead of individually.
We could put the big picture here. The best way for you to implement it into your classroom is still to go say, let's just say, hey, I'm the neuro instructor. I'm going to go to the Neurosims and I'm going to look at what's available. I'll click on the one that I want, and then I will copy that page title with link.
Perfect.
Yeah, so that's the easiest way. Right now, what you're going to see very soon is, right now we have these different mini sims. Mini sims to me are 10 minutes long. They're very short, very defined. And my goal for this is I want to expose them to the patient, to the application of the test and the grading of the test, to make some interpretations. The macro sims that we already have, two big ones that we've created. I think one is a TBI, one is a TBI patient, one is a stroke patient. I think we're working on a Parkinson's one. It's kind of like eval and treat, the entire scope. It's a much longer game, but it allows for the connection of all those dots, which I think is kind of valuable. That will show up not under mini sims, but under probably macro sims. And that will be coming soon. We're vetting them. James is part of the vetting process. We go through and test all the accessibility requirements. We have to generate the key. So you'll see that there will be more and more mini sims and macro sims coming. I think there's a finite number that we're going to make. So I would love to hear from you. James, if you don't mind just typing my email into the chat. If you're like, Mike, it would be great if you had, evaluations of these 5 main types of patients, which is, I mean, we've thought about it. So there's a good chance we're already on it, but I'd love to hear from you. Like, hey, for your mini games, have you considered like a vestibular mini game or a full vestibular eval and treatment so our students could play through it and learn it? We'd love to hear it. We're committed to building this kind of stuff. We have a studio where we bring patients into and we film all of this stuff. So I would love to hear from you about that and continue to get feedback from you as you're playing through this. You can see it's a massive endeavor, but our hope really is that we can improve student learning and really make faculty lives easier. Because when we can free up some of your energy, you can think more about the teaching while we provide the resources that you can depend on. So I'd love to hear, I mean, if you guys have any thoughts, and know that we are in the final phases of finishing up a neuroanatomy app that is designed for teaching and learning. It's not 3D4 medical, it's not living body, it's not these amazing pictures that you have no idea what to do with anymore. It's really designed to talk about tracks and to talk about lesions and to talk about different parts of the brain from a very foundational step-by-step learning. So there will be interactive learning modules that the students will play with as they're learning about neuroanatomy. So that is something also that's, I mean, it's over 1.5 years in development. It's taken a lot of time, resources, but it's coming. So yeah, any thoughts, comments, questions that I can help to answer?
There was a question in the chat, Mike, from Denise about the students having access with a paid subscription, and maybe Denise, you can clarify whether you mean any, all, or part of the utility of the app, or because obviously students need to subscribe to the app, but I don't know if your context is just the grading and those things or whatever. So you can look in the chat real quick, Mike, at 9:51.
Just general access. So if I'm trying to use this in class, so forgive me, this is the first time I haven't really ever used it. So
no worries, no worries.
In other words, what does it look like for me to use this and make it available from a financial aspect?
Yeah, absolutely. All faculty members have full access to this. So we basically give faculty members recurring 3-year access.
No charge.
No charge. It's just our gift to the academic community because we're all academics. So you could utilize this and share videos on Zoom tomorrow. If you want students to be able to watch those videos on their own because you're putting links into your lab handouts, then they need to purchase a $99 a year subscription, which supports basically our development of all of this content and maintenance and hosting and building. So it's $99 a year. I mean, many programs are eliminating certain textbooks that they just don't need anymore because they can teach all of range of motion MMT with a bunch of really good videos. So when you look at the resource as a whole, the $99 is really just the price of any one textbook. The students have access to all the things that I've showed you, all these learning reports, all these simulations, all of these games, and all of these apps. They're all available. So they affect your assisted devices class, your cardiopulm class, your peds class, your taping, lines and tubes, gait, all the neuro, all the ortho, all the pharmacology, range of motion, physical agents, surface anatomy palpation. I mean, it covers probably 60 to 70% of your curriculum with all the videos you need to run a program in reality. So it's essentially the students pay for some programs, for example, right down the street, Western University, they buy access for all of their students because they use it in all of their classes. So from the beginning of the program to the end of the program, the students have this from day one and faculty are just using it in all the different classes. Some programs, they will just say, hey, this is the required text. We're going to work with the bookstore so that your financial aid can help pay for it. So the bookstore works with us to allow students to purchase access to PhysioU, and it gets cheaper. So the more years you buy, the cheaper it gets. Usually we just direct students here on the main website. If you go to student super savings, you can see that it's $99 for a year, $169 for 2 years, $219 for 3 years. So for the price of 2 textbooks, maybe 1.5 textbooks, you have all the videos you need to run through PT and PTA programs.
Thank you.
Absolutely. Other comments, questions? Anything that I can help to answer in terms of, I mean, I built this webinar really so that faculty could figure out what's in an app and how they can start using it in their classroom tomorrow. So if you have questions about how can I find this? How can I add videos to my lab handouts? All of these I'd love to help answer.
I recently had a conversation with a faculty administrator who said that the PhysioU is almost like their score builder. You know, they use it at the cumulative because it's just there forever. They take it in the clinic with them, and it also is their first tool for studying for state boards or for the NPTE. So, you know, it's a very useful tool in that sense. So I think it's helpful.
Yep. Any other comments or questions? How do we get access to the resources from MUSC? All of that is actually in you just access it through PhysioU. So it's part of the PhysioU collection. So here's the Neuromuscular Rehab app. When you click on it, it will take you to all of these resources. Essentially, PhysioU has partnered with MUSC, and soon all of this will be in-house in the same exact format as how we organize all the other apps. It's just that we just haven't finished porting everything over yet. So you have access to all of your students who have subscribed to this, and you as faculty all have access to this through the Neuro Rehab app. So that would be this one right here.
Mike, there's one person on the chat that's having trouble finding the faculty resource.
So you have to make sure that you are currently logged in with your faculty email. The other thing that we tried, Teresa had that same problem yesterday, and that was you may have to refresh your browser. You may have an old version of PhysioU cached in your computer. And so if you refresh Chrome, I would have to Google how to do it. But if you want to reach out to me at mike@physiou.com, we can walk you through it. The educator resources are available typically in the sidebar for any app. So if I go to PNF, here's the educator resources. Students don't have this option here. And when you go to any of the Sims, if you go to any of the Sims, you'll see that only educators have access to this course key. So if you don't see that when you're logged in, maybe you can just shoot me an email at mike@physiou.com, and I can kind of help figure out what's going on. We can kind of double check that your current access is a full faculty, like there's permissions that come with different accounts. Other questions? I'm kind of curious, actually, for those of you, the neuro faculty who are still here, how are you wrestling with the PNF content? What are your thoughts about that? Should the PNF app no longer be in PhysioU, or is it a useful resource that faculty can pick and choose to use or not? I'm just curious of your thoughts.
We still teach it in Herzing's Orlando campus for PTA.
Got it.
They expect it clinically.
That's
and
right.
It's still a little bit on the national exam.
Yeah.
For us. So we utilize it a lot. And quite honestly, it's a skill that the students can take out and use, you know, like sometimes it's, you know, a lot of that stuff comes clinically. And so it's nice to actually give them specific techniques, at least they can start to build their repertoire with.
Yeah. Yeah, I see from the chat as well that a lot of people, I think, you know, that's the thing about evidence-based medicine. It's easy. It's easy to throw out everything because the evidence doesn't reveal its efficacy. And yet I think there's so many things built into it that you can allude to, you can use to shape the way students help with movement, that sometimes it'd be a shame to completely just eliminate it, you know? So yes, it looks like Denise also says it's nice to teach the basics.
I asked a question in the chat, Mike, rhetorically, we got some answers that, number one, do the clinics and the clinical instructors still expect students to have it? The old farts who still serve as clinical instructors, may still think, hey, we need to do it. Number two, is it a CAPT
Which is who you,
requirement?
James, the old farts.
Yeah, that's me. I'm talking about me. And then does CAPT still have it as a requirement? And we had some great comments from folks saying, yeah, Therax and stuff like that. Neuro Rehab doesn't specifically name PNF, but works. And number three, when is it going to be taken off if it's found to not be a favor as a entry-level education unit? When's it going to be taken off the NPTE? So, you got to get them to pass board. You got to have them successful in the clinic. And
Yeah.
then what's the expectation of people out there? So I think when those three answers no longer are yeses, then it kind of falls off. And I said, it'd be kind of nice to have a kind of a focus group or a panel at CSM to discuss the future of PT.
Well, I'm sure. I mean, I'm sure
PNF. Yeah.
that kind of conversation is happening quite a bit. But yeah, it's a good point. I mean, the clinical community still expects a lot of the orthopedic techniques that I don't want to teach anymore. So my CI just showed me this. I just didn't know what it was until now. Okay, got it. Yep. So it is useful as a way to introduce them to many of these foundational techniques.
I think that also it's like you're not going to make them pass the Vallejo PNF course certificate exam. It's like your hand unit in ortho, Mike. You're not making them CHTs, but I need to give them a familiarity with how to get around hand and how to make splints, maybe, so they're successful and competent in the clinic. They're not expertise, CHTs. So what level of information and introduction do they get to that material, PNF included?
Yes, yes. Other comments, general thoughts or questions? This is great. Yeah, this is great comments, Denise. Hey, I just want to wish all of you a safe semester. Man, dig deep, think about our students. And I think as challenging as it has been a challenging year for me, having enjoyed every single moment of my teaching for the last 20 years. I hope that these resources will help make your classroom a little bit more bearable. Not even more bearable. I know, because we're looking at Zoom for the next few weeks, and without these videos, I just don't know what I would do. So I'm hoping that these videos will be of great use to you, and hoping that all of you guys are able to stay well and safe, and that your students continue to have a great learning experience. So thank you for joining us. Next week, Friday, we are doing the orthopedic sims and the orthopedic apps. So feel free to spread the word. If you teach orthopedics, feel free to join in. There's a lot of great stuff in the ortho. That's my baby. So thank you guys so much for joining us. And please feel free to reach out to me at mike@PhysioU.com if you ever have any comments or questions. Love having your feedback.
And this is recorded too.
Yes, this is recorded as well. So you'll be able to find this and share this with